So there's a public health concern. How safe are you in terms of the food that you consume? It is a simple question, but the answer is so difficult to answer, especially with the outbreak of anthrax here in Ghana. Officials continue to manage the situation, but the minority in parliament is indicating that they will need resources to fight the outbreak, which is significantly very low now and may not be enough to effectively prevent the spread. One person has already been confirmed dead after consuming some anthrax-infested cow meat. So let's start from Parliament, where the minority there has been raising concerns about the management of the latest outbreak of anthrax. Minority MP for Napdam, who's also a member of Parliament on the Health Committee, Dr. Mark Ketwani, wants the issue to be addressed.
This outbreak is about the whole region. It is about where the meat supply of this country. I'll say that about 40 to 50% of the supply of animals to the slaughtering houses in Accra, Kumasi, etc., are coming from that end. And so we should not take it for granted. If in the north, yes, the animals are dying, when we don't take time and we get these animals to the southern sector, where when they come in, they are just slaughtered and eaten. It means that we will have a lot of human cases when it gets to the southern sector. What is happening is that even though the Ministry of Health and the Ministry of Food and Agriculture, through their veterinary services, and the local government ministry have come in and they've put in some measures, it appears that they are not putting in enough resources to curtail this outbreak. You know, to curtail the outbreak, we need to vaccinate the animals. We need to fumigate their stalls, their pens, or wherever these animals are living. We need to do it. We need to prevent the movement of animals from one end to the other. All these measures have to be done, and it requires resources. As I am speaking now, in the Tennessee district, the district assembly itself has spent about 16,000 Ghana cedis to purchase 8,000 doses of the vaccine to vaccinate the animals. But what do we see? This is not enough. We know the common fund is not coming. I have to say that we don't have to take this thing for granted. When it gets to the animal to human transmission, and a lot of human beings get it, and we start transferring it from one person to the other, then we are in very, very bad business. It's a very serious situation, and we shouldn't let it get to that stage.
The lawmaker himself, who's a medical doctor, has an advice for his kinsmen, asking them to stop certain cultural practices which spreads the disease faster.
I also take this opportunity to advise my brothers and sisters from Upper East. The funeral season have just ended, and I'm sure this is why about 3 people have died from this anthrax. During our funerals, we usually, as part of our custom, we kill animals to see our beloved ones out or buried. And after killing these animals, we don't eat it immediately. We leave it to be lying outside. We leave it, sometimes it is hanged on a tree to be shared among families. Sometimes it can take 8 hours. Sometimes it can even take up to 24 hours before this meat is shared. And I believe that this practice should be stopped. We should first and foremost try to kill the animals under hygienic conditions. Secondly, we should share it immediately after killing them. And it should be under very, very hygienic conditions. that we should carry out this activity. Yes, it is our custom. We do it every day, depending upon the status of the man in society. You could get even up to 10 or even 15 animals killed. Cows, sheep, goats, etc. killed. But we should make sure that when we do that, we should immediately share it and eat it, or boil and eat it. And this practice where some people eat raw meat should stop. Considering the impending epidemic that we have, it should stop.
Well, so that's the concern coming through from Parliament. What's been done to contain this very reports that we're hearing of? Let's speak to Dr. Benjamin Kisisasu, who's the Deputy Head, National Food Safety Lab of the Veterinary Services. Thank you so much, sir, for spending some time with us. First, there's a need for us to get some updates on even the reported cases of anthrax here in the country. How are we faring, first of all, as a nation in terms of the case count?
Great. So currently in Ghana, we only have one region having this issue of anthrax, which is the Upper East. Just that from the district that started from Binduri, we have had additional districts in addition. That is about 10 more districts joining, but all in the Upper East. It was unexpected because looking at the practice in terms of our animal production system, they go for grazing. So they may move from one community to the other. That's why our first release cautioned or called for ban on movement of animals within those affected areas. And we are happy to say that so far so good. The outbreak is only in Upper East, and we are hoping it still stays there. We have had this type of animals be involved: cattle, goats, sheep, and pig. The highest among all has been that of sheep, being 49 out of 90 animals being affected, followed by cattle, 34. Then we have goat, 5, and have that of pig, 2, making a total of 90 so far. And all the districts, as we all know, has been the district found in Upper East. Bindu, which started, had still the number of higher cases, and it was just from the first initial cases it has gotten. It has not had repeated cases. What has been done is the vaccination. And as at yesterday, 13th June, we have 21,263 animals vaccinated against anthrax. The good news is that veterinary service for many years have had a vaccine production unit, and one is at Ontamale, which is a central veterinary lab, and they already had stock of them. They weren't free; people were paying for them. So when it came to this issue, as you know, assemblies had to look for money to do so, and the ministry also considered how to get them for us for free. If we got to the state of importing, that would be a big issue. But we have the capacity, and we are producing a lot of these vaccines. We have a lot of vaccines in stock. And out of the 21,263 animals vaccinated, we have 6,987 cattle vaccinated against anthrax, goats 7,304, sheep 6,471, and we have pig 501. And so far, more vaccination is going on, and as we speak, it's going on. A strong team of delegation have left Greater Accra as at Monday to visit the place to interact and make sure we contain the issue in Upper East and not get more districts joining in. And we have had suspect cases in other regions, which we have checked, and it wasn't so. We still want to advise the public that as they are doing it, they should let us know about any suspect cases when animals die or get sick. They should still alert us.
But the general public you're talking about would definitely need to know the extent of infection and even, generally speaking, how damaging this virus can be. What's the mode, first of all, of transfer, and what could be the possible effect on any individual who contracts the disease?
Okay, so anthrax is a bacteria. There's a special bacteria, we call it Bacillus anthracis. It tries to survive in the environment by forming a spore. A spore, we want to mean that it forms protective coat all over and can stay in the soil for decades. Averagely, we have by research, 60 years they could stay in the soil. And for humans, for us to get it, unless we are taking it in through the food, being milk, being the meat itself, or we have breathed in through inhalation the spore, then we could get this. But most common cases so far per research or per case that have happened has been through the injection, and that of the human case that we had was through injection in Ghana. So sad that we are in June, and every 7th June is set aside for World Food Safety Day, and the amount of this month which veterinary service was using to pay, used to advise the public. We have had this case coming out. It's so unfortunate, but it's also come to underscore the need to inform the public about the need of food safety in regards to animal food products. And when it comes to anthrax, we want to let people know that you need to get your animal food product for approved sources. It may come from a slaughter facility and your milk. Those are things that we need. For animal to animal transmission occurs very fast. And for farmers or people who keep animals, we want to tell you that the animal that we have one day or in the morning, you get up, you see standing dead, become bloated, and we have bleeding coming from the natural orifices, especially the nose. And all this, when it happens, you are not supposed to open a carcass, quickly call the nearest veterinary office to come to take charge of the carcass. Remember, when you then open this carcass, the environment gets contaminated. And as we said, the spore is able to live 60 years in the soil. If you decide to bury it yourself, you may not do it in a proper way as the veterinary service together with animal, together with the environmental health people will do.
We'll talk about the opportunities available shortly. There's a question about resources, which has had some minority members of parliament raising concerns, for instance, about how you're not sufficiently equipped, retooled, or perhaps giving enough budgetary support to fight this. How urgent will that need be?
Great. Just yesterday, the minister launched the enhanced plan for food jobs. We had got a new minister, with Honorable Brian. He was communicated about the issues, and already before the outbreak, he had taken update, or he has taken stock of our assets and what we need to do in terms of staff strength and equipment and restocking the lab. All these things were on before this occurrence came. So quickly, he is currently attending to the issues of resources to contain this issue. And as I said, a strong leadership have left Accra to help. Though initially certain items or logistics have been sent, they have gone to look at it. And there have been also committee at national level to look at educational materials and how to inform the public and also prevent such occurrences.
Have you been able to track the source of this virus?
Currently, they have had some studies. It's pointing to, they feed ruminants, they go for grazing, they feed from the ground, that's the grasses. And already the spores normally are kept in the soil. Let us not forget, the northern part of the country have already from time to time been having 1 or 2 cases of anthrax. Just that this year, unfortunately, there has been human involvement. That's why much attention is being coming towards that. But the truth is that we have had 1 or 2 cases year on. So the spores have already been in those localities. But sometimes the locality people do not report. So they stick to their own bearing of these carcasses. And we are sure with the rainy season and flooding and other human activities like digging may have exposed these spores to these animals. And this have occurred. And that's why we feel after all these things, we need to throw more light about the need for people to contact veterinary service when it comes to issues of animal disease.
Let's get to that then. The opportunities for the general public to report cases and what we should be wary of.
Great. Right now, we'd like to tell people that, as we said from last week, our first update came from the ministry on the 6th of June, and today is exactly 1 week. We have been able to control it and contain it in one region, just as I've had few districts in the same region having them. Vaccination, look at the data, we have gone far ahead, so they don't need to panic. The issue is that we should continue to be reporting of suspected cases, and which general public are doing very well to the nearest veterinary offices, and it's a good thing they are doing. They should also report suspicion of seeing people trying to sell or trying to use dead animals for food or to sell them. Is wrong. Even in normal times, we are not supposed to eat a dead animal. No, it should be a slaughtered animal, gone through all the veterinary inspection and go through all the processes.
Okay.
So we like to tell the public to heed today's call and help us to do the work well.
Grateful. Dr. Kisi Sasu, thanks for spending some time with us. Keep up the fight.